We go.
All right.
Hi there. I'm here with Dr. Ehie, who is the new Vice Chair for Diversity, Equity, Inclusion in the UCSF Department of Anesthesia, and also an awesome pediatric anesthesiologist in our group. Thanks for joining us, Odie.
Thank you for having me, Dr. Fershall.
And
by the way, we're all on a first name basis here, so don't be fooled.
Yeah, exactly. I'm like, Dr. Fershall, who's that?
Anyways.
Anyway, so why don't you tell our applicants a little bit about diversity, equity, and inclusion initiatives here at UCSF, and also your role within the department.
Absolutely. So first and foremost, I'm super excited to have the opportunity to talk to you about DEI here today. One of the things that I'm incredibly excited to talk to you about actually is pretty much our DEI training that we offer for not only our residents, but also our fellows, where it really composes of interactive workshops. And it really focuses on unconscious bias, allyship, tools to address microaggressions, really at the forefront of what we're doing today, and really making sure that we enable not only our trainees who are in the residency programs, but also our fellows across the whole department in knowing what tools to use to face basically the ability to be an inclusive ally in our department. Now, one of the things I'm also excited about is that we want to roll this out to faculty members as well too. So we can certainly talk about DEI initiatives among our trainees, but it really starts from the top down. And so being able to enact and really provide this for faculty members, which is one of my top priorities and what we're hoping to do before the end of the academic, well, at least before the end of December, to really at least get an unconscious bias training, interactive training going, getting tools on addressing microaggressions so that we can actually enable our faculty members to be even better allies for us as trainees. I think that's at the forefront and one thing that I can say that we're extremely proud of here at UCSF.
Yeah, it's great work. And we really appreciate all the work you're doing for it. And what would you say the culture of DEI, especially inclusivity, is in our department at large?
I mean, I think we're already at the head. We're ahead of our institution within our department. The fact that we're really procuring time to do interactive trainings on this work is something that is pretty innovative and at the forefront. The other thing I would have to say is that I feel that the leadership, they're also very proactive and also making sure that we really provide these tools, these trainings, these topics, mentorship. We're being much more intentional in mentorship, which I think is really important. We've already provided that within the residency programs. One of the things that I think we take for granted is that we leave sometimes mentorship to chance. But when we start being intentional and making sure that we pair and we don't leave things to chance, we really kind of get at the forefront in treating all of our trainees in a much more equitable fashion. And so we're doing that actually with the fellowship program, and where we're going to be intentional in making sure that individual fellows are paired, and especially those who come from marginalized backgrounds, paying attention to making sure that they don't feel that they're not included in the work environment. So that's something that I'm incredibly excited that our leadership is already doing. So I really think that's something that we pay attention to, and making sure that leadership is also mindful about that, and something that we're already doing across the fellowship program. So super excited about that as well.
Great. And then let's shift gears a little bit. I know you've been very involved in global health work throughout your career. Can you tell me a little bit about your involvement in global health?
Absolutely. One of the things that one of the hats I wear is that I am an HVO. I don't know if anyone's heard of the Society of Education and Anesthesia Fellowship, but it works through the Health Volunteers Overseas organization. And so this is a program where the CA3s actually get to go for a month rotation, either to Vietnam, Rwanda, Malawi, or Ghana, all paid. And I serve as one of the co-site directors in Vietnam. So that's one of my hats that I wear. I also am the designee chair for the Society of Education and Anesthesia Global Outreach Committee. And so we also collaborate with ASA GHO committees because we know they also have a traveling fellowship as well. And essentially we kind of work to collaborate to see what's happening in other different sites. But our goals are really to provide didactic as well as interactive educational training modules within different sites so that we really not only go and provide anesthesia, but we really train and really try to provide a mutual educational relationship among our different sites in order to not only impart knowledge, but also to kind of gain knowledge from them with what they do in a low resource or middle resource income setting as well too. There's much to be learned. So that's one of the hats that I wear. Another thing, because within our institution, we have what's called the Center of Global Health, which is actually turned into the Center of Health Equity among Surgery and Anesthesia. We call it CHESA. And so we've actually created a center where we collaborate with surgeons a lot more closely within our own institution to kind of make sure that we're aware of more projects that are going. We're able to actually give the ability for trainees to collaborate more. We're inviting global health fellows to also to be part of this community. And the other thing is we are so open that if we know that we have individuals, whatever type of fellowship that they may be interested in or are doing. So if you're a pediatric anesthesia fellow here, it would be very easy to actually be incorporated within that community if global health is something that you're interested in doing, so that you can actually learn of other projects that are going. If Vietnam isn't what you want to do, or Rwanda is not what you want to do, or Malawi is not what you want to do, or Ghana is not what you want to do. What this CHESA community allows us to do is to actually be able to go to multiple different sites through our different relationships at other institutions across the world. So that's something I'm also incredibly excited about that really we're able to bring to within our fellowship.
Yeah, that's such an awesome opportunity for people who are interested in global health equity work. So thank you. Thank you for telling our applicants about it. And I will send them your way if they have some further questions about the global health projects or DEI initiatives at UCSF. So thank you for your time.
Thank you so much. Thanks, Marla.
Have a good one.